Hello, my name is Vicky Kiesel. I'm a registered genetic counsellor and I'm here to answer some of the common questions about genetic testing. BreastGene, what do we test for? BreastGene is a genetic test which examines in detail the DNA code for 10 specific genes. These genes have been shown to cause an increased risk of breast cancer and in some instances other cancers. The test includes the well-known genes BRCA1 and 2, P10 and TP53 as well as several others. What are genes? Genes are the body's instructions and determine how the body develops and is maintained. Some genes prevent cancer developing, so if there's a mutation in one of these cancer genes, then the gene doesn't work correctly and this causes an increased risk of cancer. Why would I want a genetic test? Genetic testing can help to determine your risk of breast and associated cancers. If you do have an increased risk, then there are several things we can do to lower your risk or to find cancer early should it develop. Some of these options include risk-reducing surgery, medication, and increased screening such as mammography. Why is genetic counselling important? Genetic counselling assesses a person's family history and provides an individual risk assessment. The genetic counsellor also explains exactly what the test includes and the implications of testing, including the risk of cancer and any necessary cancer screening. How does the test work and how long do the results take? The test is performed on a blood sample and the results will be available approximately 8 weeks after you have had your blood taken. An appointment will be made with the genetic counsellor who will explain the results and recommend appropriate cancer screening. The test uses state-of-the-art technology known as new generation sequencing to examine the code for each of the 10 genes in detail. In addition, further analysis is used to look for large missing or extra parts of selected genes. Who should be tested? People at risk of hereditary breast cancer may wish to consider genetic testing, and where possible, it is always more informative to test someone in the family who has already had breast cancer. Most breast cancer occurs by chance. However, approximately 5 to 10% of cases are hereditary. Families with hereditary breast cancer generally have several close relatives with breast cancer, often diagnosed at younger ages. A genetic counsellor can assess your family history and tell you what your personal risk is. What does it mean if a mutation is found? It means that you have an increased risk of breast cancer and possibly other cancers. It may explain the cancers in your family. Your exact risk of cancer will depend on which genetic mutation is found. More information can be found about the exact risks in our BreastGene brochure. What does this mean for my family members? If a genetic mutation is found in the family, it is possible to offer genetic testing to other relatives to help determine their risk of cancer and recommend appropriate screening or treatment. When someone has a genetic mutation, there is a 50% chance that they will pass it on to their children. What can I do to lower my risk of breast cancer? There are several things you can do to lower your risk of breast cancer. Maintaining a normal body weight and avoiding abdominal weight gain will lower your risk, as will limiting your alcohol intake and doing regular physical exercise. How do I book an appointment to discuss the test, and do I need a GP referral? Please call 0800 085 6616 to book an appointment with a genetic counsellor to discuss the test. You do not usually require a GP referral. Initially, you will be sent a family history questionnaire which will be analysed, and then an appointment will be scheduled for you with a genetic counsellor at a mutually convenient time and date. Following your consultation, if you decide to have testing, you'll be sent a genetic testing kit and asked to have your blood taken at one of our convenient blood drawing centres.